Welcome to a powerful journey of purpose, collaboration, and partnership. Momentum Health and its affiliate Metropolitan Health, both part of the Momentum Group, invite you to see firsthand how strategic investment and public-private partnerships are transforming healthcare in South Africa. Our journey begins in rural communities where millions of people face real challenges to access specialist healthcare. Even something as simple as spectacles is out of reach for most.
One of the challenges that patients in rural communities face is the access to care, as the outlying rural communities would need to access the transport system in order to get to a hospital that would offer optometry.
80% of the population are not covered by any insurance. In rural areas especially, accessing just an optometrist to have an eye test done is almost impossible. People have to travel hundreds of kilometers in order for that to happen.
And because of that, you would find the patients are perhaps put off seeking the care, and by the time that they need the care, the conditions have become quite urgent. The need is to at least close the gap by taking the needed professions to the communities and allowing them a fighting chance.
Momentum Health very graciously came on board as a partner with AMS to look at 2 districts in KwaZulu-Natal where we tried to decrease the burden of eye care problems.
The AMS, with our knowledge of how the rural hospital setting works, our knowledge of what it takes to get medical professionals into a rural setting, we were able to bring that in, and we're a logistical partner that knows how to coordinate rural health outreach. The AMS has done this for years.
There were about 300 patients who were screened, about 250 pairs of spectacles dispensed, and over 40 patients referred for further care. The impact that that has on an individual's life is unparalleled. It's something you can't put into words. It's not tangible. It means a person who may not have been economically active before is now able to go and work and earn a living to put bread on the table. The partnership with Momentum Health and AMS on this particular eye care project is a classical example of how, when different partners come together for a common purpose, the social impact can be so huge.
From rural eye care outreach to open heart surgery, we welcome you to the Nelson Mandela Children's Hospital, where a growing backlog of young patients awaits life-saving surgery during VSD week.
My daughter was born with a hole in her heart. We actually found out when she was 8 months. We just took her to the hospital because she had a cough. So when the nurses checked her heart, it was beating abnormal. Because I even saw the scan. When the heart was pumping, I could see the hole. It was big.
A VSD stands for ventricular septal defect. It is a connection or hole between the left and right circulations of the heart, and this communication is abnormal and should not exist in the normal heart. As a result, complications do occur in kids that have these defects, which warrant surgical closure.
Momentum called and said they're going to fund us with the surgery, and that was the happiest moment. I screamed, I did everything, because when you think of the surgery, it's 100 and something thousand, and you don't even have 100 rand in your bank account. It was heartbreaking. It was tears of joy. It was tears of everything.
Partnerships like these between Momentum and Nelson Mandela Children's Hospital is greatly appreciated. This is why we've implemented what's called VSD Week. We fast-track these VSD cases and do them in a short time, like a week or 2. Our operating time for a procedure like this is usually about 3 hours, so we can afford to do a few of these cases in one day. These patients are generally patients that we expect to go on to lead a normal life after the surgery. We don't expect them to have future surgeries, and they're quite curative conditions.
Thank you to Momentum for funding us. I was going to be on the list till today. If I didn't get funded, I will still be on the list. May you continue what you are doing, because there are more parents who are still waiting on the list, who needs your help. So whatever you did to my family, continue to do it. We are very grateful. Thank you.
Our efforts go beyond treatment, from teletriage systems saving 3 million rands in salaries to restoring dignity with hospital upgrades, focusing on more health for more people for less. Together we can build a future where quality healthcare is not a privilege, but a promise.